Good afternoon. My name is Dr. Tricia Masters, and I'm a pediatric nurse practitioner at Mulberry Pediatrics. I am a part of our pediatric team, and we aim to build long-lasting relationships with your family. We're honored to be a part of your family, and we're honored to be entrusted with the care of your child. In today's family-friendly video, I would like to share information on how we do mental health and behavioral health screening for our children. We actually do this across the lifespan of the pediatric time frame, meaning we're checking these types of things from the time that the child is born until the child graduates from our office, in later adolescent years. So when a baby comes and sees us, we are often checking the heart rate. We're listening to the lungs and checking to make sure that growth is happening the way it's supposed to. But not only are we checking growth charts, but we're also checking to see how the baby is responding to the environment, and responding to us, responding to their family. We're also checking to make sure that the mom is doing okay and that the dad is doing okay, because these are all a part of the emotional and behavioral development of the child. So when your child comes in for a checkup, often we will give you a piece of paper. Sometimes we may just ask you questions in person, but in different ways we are going to be asking and checking on the emotional and behavioral health of the child. So what you may do is, for example, when you come in, we may hand you a piece of paper and we may ask about the child's development. We may ask about how things are going at home. We may ask about how easy it is to be a parent to this child. And so we would really appreciate honest answers to each of these types of questions so that we can work together to see if there's any issues that need to be taken care of. When your child gets to be older and school age, we ask other types of questions. We ask how they're doing in school. Do they have friends? Do they have any issues with their grades and interacting with their teachers? And a lot of times this provides us some information about their mental health and their behavioral health as well. Finally, when a child or a young person enters high school age, we will also be asking questions, and they will be also different questions than we ask to the younger children. And so don't be surprised to see that we may ask about things like sleep and friendships, and even things like, do you feel like you need to hurt yourself? Because these are important conversations to have, especially in this day when we are seeing that the suicide rate is very high, especially in teenagers. So these are all things that we're being very cautious about, and we would like to be a part of trying to find a solution for our young people. So in conclusion, again, we appreciate the chance to be able to be a part of your family's life, and we appreciate that we would want to provide care like we would have for our own children. And so we do try to strive to do that every day. Thank you again.